So she's not going to come on camera and say it, but my wife was just making fun of me for doing a video about a doctor listening because she thinks I often have trouble listening to her. So as we go through this, maybe we will both learn something. It is the best I got, but hopefully we'll understand each other a little bit better at the end. I think when you don't think that your doctor is listening to you, it can be a hurtful thing. You're usually not coming in to talk about the weather. You're talking about your health, and it's something that matters to you. And if you leave a doctor's appointment thinking that you didn't get listened to, or that someone doesn't believe you, or that you don't have an agreement on the plan, as it's your health, it can cause problems, right? You leave frustrated. And I'm just going to throw it out there. It is very possible that your doctor didn't listen, right? That could be a thing. Most doctors are human beings, and if you get any group of humans who are big enough, some of them are jerks. So maybe your doctor's a jerk. I don't know. There have been days that I have been more patient and days that I have been more good at listening to someone than others. And some days I'm not so great at it, and some days I'm better. But I think it is important that when you're trying to figure out how to communicate with somebody who has so much influence on your life, like your doctor, that it's a little bit important to try and understand the ways that they think and the way that they communicate. So I'm going to try and at least explain how doctors think through things, and maybe it will help you identify the places where you're not finding agreement, and maybe it will help you communicate what you're looking to get from your doctor a little bit better. And hopefully you'll just be a little bit happier. And even if it doesn't solve your relationship with one particular doctor, it might help you communicate with some in the future. Okay, so the first area that doctors and patients sometimes have communication issues with is talking about symptoms. And I do think it's fair to just admit up front, doctors are human beings. Sometimes we have bad days. Sometimes we are better at dealing with people than others. And sometimes a doctor just doesn't believe you. And I know that can be hurtful, and I am sorry, but I'm just trying to be honest that it's a thing sometimes. Also, sometimes someone comes in and they want to talk about a symptom and say, hey, man, doc, my elbow really hurts. And we start talking about your elbow, and you tell me that the reason your elbow hurts is because you've been falling 7 or 8 times a day because you can't feel anything on your right side. And now I'm thinking, are they having a stroke? Did they have a stroke? What's going on there? And I'm no longer going to be able to talk about your elbow pain because I'm trying to keep you from dying of having a stroke. And you may really want to talk about that elbow pain, but sometimes, because I'm trying to take care of you, I got to really focus on something else that could be much more life-threatening or serious immediately to you. Sometimes someone will talk to me about a symptom, and the symptom that they're describing, I totally believe they're having that sensation, but the term they're putting on it is just a little bit of an inaccurate way in the way that doctors use terms. Doctors have so many words for all the things. We make our language sometimes a little complicated for everybody else and harder to understand than it probably should be. But if you come in and you describe something to me and I go, yeah, I totally believe you're feeling that way. It's called this, but it's called this other thing, but I totally believe you. Sometimes it feels like I'm not listening, but I totally am. We're just trying to use the medical terms for what I'm trying to keep track of stuff, because other doctors have to come in the future and they use the words that I use. And so we're just trying to make sure we're on the same terms. I think the next one is one that is particularly hard for people. And this is the diagnosis part of the communication issue. Because diagnosis really matters. There's a lot of emotion wrapped up in certain things. And when someone tells me that they really think the problem they're having is X, hey doc, there's something wrong with my heart. And I say, you know what? I believe the symptoms that you're having. We talk through it. We do all the workup. And I'm telling you, you've gotten the bajillion-dollar workup, and there's nothing that anyone can find wrong with your heart. The cardiologist can't find anything. I can't find anything. You've had multiple workups over the years. And maybe it's not your heart. You are maybe having that chest pain, but maybe it's not your heart. And I think that when a doctor doesn't agree with a diagnosis that you are either scared or convinced that you have, it can be problematic for you, right? And because it can kind of put a strain on the relationship sometimes. But it's not that the doctor isn't listening to your symptoms. It's just sometimes we really think something else is going on. Here's another one that I think is probably more the doctor's fault than anything else. Sometimes we don't know what the diagnosis is. Medicine is complicated. Bodies are complicated. And sometimes when we just literally don't know what's going on, we are not good at telling you, hey man, I believe you have something happening, but I don't know what it is. And we would probably communicate better with patients if we were a little more comfortable to just admit sometimes that we just don't know what it is, and we're willing to keep trying to figure it out. Sometimes we just literally don't have an idea. The next area that we can have some disagreement with sometimes and some kind of communication issues is what to do with the treatment or the test for the diagnosis. So maybe we agree on the symptoms, we agree on what the diagnosis is, we agree on what the problem is, but what do we do about it, right? And sometimes what you want and what you've researched and what you think is going to work for you is just, for whatever reason, just not what the doctor thinks is healthiest for you, not what the doctor thinks is the appropriate treatment, and they just can't go there with you. Sometimes the reason that they can't go there with you and they can't offer that particular treatment or test or whatever it is that you're asking for is because the risks are too high. And so sometimes something that worked for somebody else just doesn't work for you because the risks are too high and your doctor just doesn't want to hurt you. So the last one is admittedly a big thorn in my side, right? So sometimes the patient comes in, they tell me about something, I agree what they're going through, we agree on what it is, we both agree on what they need and that it is the right thing for them, and it just doesn't matter because I can't get it paid for. The limited resources that we have to get people the care that they need is a frustrating thing that I think you probably don't understand bothers your doctors as much as it bothers you as a patient. Admittedly, your perspective is going to be different because you're the one whose health is suffering over it. But I can't tell you how many times I want to get something for somebody because it's the right thing, it's the standard of care, and there's just no money for it. I can fill out prior authorization requests. I can try and argue, do a peer-to-peer review sometimes. There are extra steps I can do to try, but there is a limit to my ability to just make resources appear, and that is frustrating for you, but please know that that is frustrating for me as well. Sometimes we just can't get it paid for, and that's why the doctor isn't getting it for you. So, we just talked about a whole bunch of ways that your doctor and you can have some communication issues, some of the common situations that pop up that might make you think that they are not listening. Again, I tried to be full disclosure. I tried to be as honest as I can. I did admit that sometimes the doctor just straight up isn't listening. Maybe they had a bad day, who knows, and they weren't at their best in terms of being a listening human being. But I think that most of the situations fall in one of these other categories, and hopefully this helps you understand the way a doctor kind of thinks through some of this stuff and will help you identify the specific way to approach your physician and your care team so that you can try and understand them a little bit better and kind of get where you're trying to be in terms of getting the treatment that you need so that you can be healthy, which is the end goal that everyone actually does want, even when we're disagreeing. We all want everyone to be healthy. Hopefully this helps you out. Leave some questions below and let me know if there's anything else that I can explain, or if you think there's something that I missed, I'd love to hear about it.